Undescended testis or absence of testis in the normal position is a common complaint with which parents come and consult the doctors. The major concerns that the parents have in this scenario is there a testis which is not there in the normal position or it's absent completely, and what are the implications in the short term and the long term. Around 2.5% of boys may have undescended testis at birth, and many of them will descend over time. However, if the descent is not complete by around 6 months to maximum 1 year, it's extremely unlikely that the testis will descend. A newborn male with both undescended testis may be a sign of emergency and should be immediately shown to the doctor to identify a cause, which may be a life-threatening condition. The abnormal location of testis or undescended testis has significant implication because higher temperature in the abdomen or higher up region can have a long-term impact in terms of the fertility of the individual. These testes also are more prone to injury, more prone to twisting or torsion, and very importantly have a higher risk of developing a malignancy. The testis develops during the fetal period in the abdomen, and from there it descends in a process, and typically by around 36 weeks most testis would be in the inguinal region, and by the time the child is born the testis will go down. The process of testicular descent is regulated via a number of hormones. Many of them are produced themselves via the testis. So the major role include the insulin-like factor 3 and testosterone, which are produced via the Leydig cell, and anti-Mullerian hormone, which is produced via the Sertoli cells of the testis. Along with this, the effect of the mechanical factor, the tone of the muscle, and the nerves also play the important role in testicular. A very common condition which results in the presentation as undescended testis is what is known as retractile testis, in that the testes are actually descended, but because of the increased muscle tone they would go up. It's very important to differentiate a retractile testis from a true undescended testis, because as surgery is required for a true undescended testis, it is not required in retractile testis. So when we examine a boy who comes to us with a complaint of undescended testis, we really look at how the testis is located, whether the scrotum is well formed or not, and whether we are able to bring down the testis into the scrotal region to confirm the diagnosis of retractile testis. Only once the retractile testis diagnosis has been excluded do we then go ahead with evaluation assessment. The most common cause of undescended testis is physiological, as we've discussed that 90% of those who have undescended testis will improve over time. Undescended testis may be an effect of a number of hormonal disorders, a number of musculoskeletal disorders, and a number of syndromes. In most boys who come to us with undescended testis, a careful clinical examination is able to confirm whether the testis is absent or not. If there is some doubt, especially in obese individuals, an ultrasound of this region would help us identify the testis. Older children who come to us with bilateral undescended testis, no testis on either side of the scrotal sac, with a normal male appearance, we are going to worry about whether the testes are in the abdomen or the testes were never there or they have been damaged because of some intrauterine event. Conducting some hormonal tests like anti-Mullerian hormone, testosterone, and would be able to identify whether there is an abdominal testis or not. And so every boy who has an undescended testis which is persisting till around 6 to 12 months of age should immediately contact a pediatric surgeon to decide about the need for intervention. The surgery is a relatively straightforward procedure in that the testis is brought down in the scrotum, and it's important to understand that this bringing down would improve the chances of fertility subsequently. It would also reduce the chance of trauma to the testis, a chance of twisting or torsion. The risk of long-term malignancy is not decreased. So boys who have a surgery also for undescended testis need to be carefully examined over follow-up to identify a possible malignancy. An increase in the testicular size or the loss of sensation over the testicular skin or the scrotal skin may be the first sign of development of malignancy. Unfortunately, we find boys as well as adults who come to us with abdominal tumors because their testis was not identified and that developed into a cancer, and that has disastrous outcome. Lot of children come to us who have undescended testis, who have been advised some injections of gonadotropins to achieve a testicular descent. These injections are not recommended these days because they have been shown to have adverse effects in terms of long-term fertility and testicular functions. So the only treatment of a boy who has got a true undescended testis is surgery. Do not go for these injections which may actually be harmful. Careful follow-up of boys with undescended testis should include the pubertal development, how their physical development is progressing, how the testis is functioning. We may do some hormonal evaluation, and very importantly, periodic checkups to see whether the testis is developing some tumor.